because when we give remedies for homeopathy, we're considering even the behaviors of the patient, the patterns of symptoms. And that's why it's a very complex approach. People think that, oh, it's only herbs, right?
Mm.
It's really not. There's something deeper to homeopathy. And again, as you ask, how did we integrate this in our practice? Is as the advantage of being integrated practitioners is we definitely do not forget the basics of our doctorship, as we call it. That we always focus on physical exams, history taking, but everybody's always affiliating us with prescription medicines. And the beauty of this is when you give prescription medicines to a patient and you give them homeopathy, they do not have bad interactions. They can actually synergistically work together in some way.
Mm.
That's
Mm.
why when you say, how do we apply it? We apply it in so many ways. When we want to detox a patient before we want to start the prescription medicines on them, or if we want to use lower doses of prescription medicines and might as well use homeopathy to fill that gap up to help the patients. So there's so many different ways in how you use it in our practice. And going to your question about what's the difference between a peptide and also homeopathy is you're right. There are similarities. They work together in a sense that you can use them together, actually,
Mm-hmm.
and they both work by stimulating natural processes. It's not superseding or adding something to your system. The difference would be is, of course, peptides would be more of something manufactured in a compounding pharmacy, for example. Homeopathy, it's actually also it's not compounded in a compounding pharmacy, but in a special what we call homeopathic pharmacy, where they
Mm-hmm.
have these specific dilutions, succussions, specific procedures in how you prepare them. But you're right, all of these methods are still inclined with integrative medicine, which are all focusing towards the betterment of the patient.
And also the messaging, like letting it's giving the body a little bit of impetus to actually create its own healing process. Like with peptides, is sort of how I understand it. It's sort of giving the instruction manual, if you like, back that you maybe had when you were younger. Let's take, say, thymosin alpha 1 or something like that. You're getting sort of the
Right.
immune function back that your thymus would have given you when you were younger, but you're now giving sort of that instruction manual back. It's sort of like the recipe. Here,
Oh,
go and
yes,
make
that's right.
the protein sort of thing. So it's sort of
Mhm.
like
And
a
with the peptides also, you have to remember that this is something innate in our system.
yeah,
And as we get older and older, this actually is decreasing in production. With
exactly.
homeopathy, this is something that is not part of our body. This is something external.
Right.
And one of the things that I apply in concepts of applying peptide therapy to my patients, I mean, most of the peptides, this is what I do, is I want to make sure the body is clean, the body is stable in order for that peptide to actually be used on a patient. So peptide therapy is not my first line for patients. I need to detox them. I need to
Mm-hmm.
make sure I optimize and stabilize any abnormalities that I see in their labs. And when I feel that when the body is ready to receive it, it actually now is going to be your second or third tier to optimize the function of the system. For
Mm-hmm.
homeopathy, it's something that we can use as first line because it
Wow.
actually can help acute conditions, for example. I mean, acute conditions are also there for peptides like BPC 157, for example, and even thymosin alpha 1 if you have an acute infection. But again, but as you can see, homeopathy can be started now. But for peptides, and they're not cheap. I tell patients you need
No,
to clean the house first so that you can optimize and maximize your peptides.
I love that. That's a very, I mean, even with like a hyperbaric oxygen clinic, um w- I've learned from Dr. Scott Scher, who's a hyperbaric physician, you need to prepare the body for the hyperbaric before you actually, ideally, if it's an acute thing, maybe you're getting straight in there, but ideally you're giving them the nutrients, you're giving them the supplements, the lifestyle interventions, the things alongside that hyperbaric so that it actually can do its job optimally. And it's the same with the peptides. If you bring in the advanced stuff, but you haven't done the foundational work, you're going to, not get the full benefit at least of what you're doing. And as you say, peptides and indeed hyperbaric is quite expensive. So you want to be doing the foundation. But sometimes that's quite hard conversation with clients because they just want the one thing. They want the one thing, the quick fix, the magic pill, or the
Well,
magic
I mean, the
therapy.
people will pay for it, Lisa. I tell you, it's just that you have to be honest with everyone that, hey, you're paying this much money, you better make sure it works. Just because we don't, of course, our reputation, our name comes along with it, but it's really your body, your system that's going to benefit from it and who's going to be using it. And I have, for example, even stem cells or exosomes people likes to get those. I always tell
Yeah.
them, sure, you want to get that? You want to make sure you detoxify. You want to
Hmm.
make sure all your minerals, all your vitamins, all your nutrients are up to the par where all of these new cells that are going to be coming in will be happy. Just like little kids you adopt, right? You want to put them in there, or you have new kids coming into your house. You want a clean house. You want everything conducive for them to grow and just be good citizens in the future. Same for your stem cells. Make that house happy.
Yeah, that makes so much sense to me because yeah, I think we all get caught up in the shiny object syndrome and the cutting edge, the fun stuff, the sexy stuff, but actually, all doing the foundational stuff, the harder work before you get to the fancy stuff would make a whole lot more sense in a lot of cases. And like cleaning up your diet and cleaning up your exercise and getting better sleep. If I'm doing some fancy exosomes and stem cells, but I'm not sleeping, I'm just throwing money down the toilet. Like it's not going to be really as effective as it could be anyway. So I think that approach is a harder sell because they just want the thing. But I think that's a much better approach. And you also are quite unique in the IV therapy world. So there's lots of IV clinics now that are doing, vitamin C's, which I do, for example, IV vitamin C. Um, there's glutathiones, there's other things, but you've taken it to the next level in IV therapies. Can you tell us a little bit about your experiences with that and what you do?
Right. So you probably are, Lisa, you're very familiar with the one-stop shops out there. The hydration bars,
Yeah.
yeah, right, the beauty IVs out there with the aesthetic practices. What we have integrated in our practice is actually a protocol of IV therapies that we have done for almost 30 years. And these IV combinations that we have had actually been proven through time to be our bread and butter. And this IV protocol that we have focuses on not only detoxification, but also repletion and also stabilizing the cellular, I guess, energetic needs. And this is, it's not just like when people come here, hey, I want vitamin drips. Sure, we'll just give you and bounce you off with so many vitamin drips. We actually have a specific protocol for them. And these IVs actually focuses on different things. For example, pH balancing. Another one would
Hmm.
be liver detoxification.
Hmm.
Another one would be biooxidative therapies. Another one would be chelation therapy. And another one would be mineral and vitamin nutrient repletions. So those, and even now we have added to our arsenal UV blood irradiation. Uh,
Wow.
yeah,
Okay.
and this is ozone
Yeah.
and EBU therapy. We now have in our arsenal to the point that this is now mixed also with our other devices that we put our patients on. So we have scalar fields here. We
Mm.
also have PMF, and you would notice that our patients are actually doing multiple things when they're sitting in an IV room. That's why it's not your regular IV bar for the reason that while they're sitting on that IV chair with their IV dripping, IV bag dripping, they're also being surrounded by what we call our other energetic accessories so that we can actually increase the distribution of these IV fluids and maximize and potentize the capacities of these IV therapies. That's
Wow.
why this is the beauty of being in Nevada. Being in Nevada,
Yeah.
practicing what we call homeopathic or integrative cam medicine with the board that we have, and this is basically allowed by our state to be practiced safely by professionals like us.
Wow. That is next level because there is nothing like that here in New Zealand, like nothing. Like we have IV vitamin C, if you're lucky, maybe glutathione, maybe that's pretty much it actually. There's not much else.
That's it.
Hydration maybe. But and even like I've been trying to open up an IV vitamin C clinic, and I have the accounts. I have a doctor overseeing it, but I don't use it yet in my clinic. I only use it for my mother at the moment. Um, and it's just like so much rigmarole and so much hoops to jump through that everything has to be completely tightly controlled. There is no talk of anything like the customized IV that you put together with botanicals and minerals and all that sort of stuff. And there must be a real art to that.